A cancer diagnosis, that phrase, it just, it can instantly shift your whole world.
It really can.
And for older adults, well, that journey often comes with this unique layer of complexity, doesn't it?
Absolutely.
You know, you might be navigating this new reality alongside other health conditions you're already managing.
Right. Comorbidities are common.
Or maybe you're just deeply concerned about keeping your independence and, well, what it all means for your quality of life. It's a lot to take in.
It is a huge amount.
Okay, let's unpack this a bit, because here's something truly essential to remember. You are absolutely not alone in this.
Not at all.
Modern cancer care, when it's done right, it's really collaborative, it's human-centered, it's, a team sport.
And that collaborative spirit, that's exactly what we want to dive into today. Our goal really is to empower you, the listener, by clearly defining who makes up this essential care team.
Right.
We want you to understand all the dedicated professionals who are ready to support you and your family. And the sources we looked at, they use this really powerful metaphor. They suggest thinking of your care team like a circle.
A circle, okay?
Yeah. And right there, smack in the middle of that circle, that's you and your family.
You're at the center.
Exactly. And every single person within that circle, they have their own specific role, but they're all working together. One goal, give you the best possible treatment while always honoring your personal goals and your values.
That's key.
Yeah. And what's fascinating here, I think, is how this framework immediately shifts the perspective. It moves from just, an overwhelming diagnosis to something more like a collaborative guided journey.
That image, you at the center, surrounded by all this dedicated support, that feels incredibly reassuring.
It should.
It brings some clarity, I imagine, to what can feel like a really chaotic time.
Definitely.
So, if we're starting there at the heart of the circle, let's move outwards a bit. To the core medical team.
Makes sense.
These are the doctors and nurses you'll probably interact with most frequently, right? The ones diagnosing and creating that immediate treatment plan.
Precisely. Your front line, so to speak.
And leading this charge, quite often you'll find the geriatric oncologist or maybe a medical oncologist. They're often seen as the captain of the medical team.
That's a good way to put it. Yeah, the captain. They specialize in treating cancer with medicines, think chemotherapy, immunotherapy, targeted therapy, maybe hormone therapy.
And that geriatric part of the title, especially for our listeners, that sounds really significant.
Oh, it is incredibly significant. A geriatric oncologist has extra specialized training specifically in the care needs of older adults.
Okay.
So what that means is they really understand the complex interplay between aging, other health conditions someone might have, and the cancer treatment itself.
Ah, so they see the bigger picture.
Exactly. They don't just see a tumor, they truly see a whole person. Their focus goes way beyond just attacking the cancer. Well, it's about making sure your treatment plan is really thoughtfully tailored to your overall health, your lifestyle, and crucially, what matters most to you.
Right, your priorities.
Yes. They'll sit down and discuss the benefits and the risks of each option. They proactively manage side effects, and they coordinate carefully with your other doctors. It ensures all your health needs are being looked after.
That whole person approach, especially for older adults, that sounds absolutely critical.
It really is.
Because, given that many older folks are managing multiple conditions, how often does a geriatric oncologist find themselves maybe dialing back an aggressive treatment? One that might be standard for someone younger, specifically because of those broader health issues you mentioned?
That's a really sharp question. It happens quite often, actually.
Yeah.
They frequently help patients weigh, say, the potential for a few more months of life versus the impact of really harsh side effects on their current quality of life, their independence.
That must be a tough conversation.
It can be.
Yeah.
But for an older adult, maybe maintaining cognitive function or just being able to get around, that might be a much higher priority than enduring a really stressive treatment that could seriously compromise those things.
Makes sense.
So the geriatric oncologist brings that specific wisdom, that perspective to the table. They help you make choices that line up with your priorities, not just what's technically possible.
Right, not just the textbook answer.
Exactly. Their unique value is helping navigate those very personal, often difficult trade-offs.
Okay, so tailoring the plan to your life, your values, that's central with the oncologist. But sometimes you need a more localized approach.
True.
So If radiation therapy is on the table using those high-energy rays to destroy cancer cells, then the radiation oncologist steps in.
Right. And their work is, it's really a masterclass in precision.
Precision.
Yeah. The radiation oncologist designs this meticulously detailed plan. The goal is to deliver a powerful dose right to the cancer while rigorously protecting all the healthy surrounding tissues.
That sounds tricky.
It is. They determine the exact number of treatments you'll need, and they're crucial for managing any side effects that might pop up specifically from the radiation itself.
Okay.
The key takeaway, I think, is their meticulous focus. It's not just on destroying the cancer, but really on preserving your healthy tissue. It makes their planning just as critical as the actual treatment delivery.
So they're like master strategists balancing the power with protection.
That's a great analogy, yes.
Okay, so precision rays is one way, but sometimes you need a more direct physical intervention, removing the cancer itself. Is that where the surgical oncologist becomes, well, indispensable?
Precisely. If surgery is necessary to remove the cancer, then you'll be working closely with a surgical oncologist.
And they specialize just in cancer operations.
That's right. They'll explain the whole procedure to you in detail, discuss what recovery might look like, and this is critical. They work very closely with the rest of your team.
To coordinate.
Yes, to decide the optimal timing for surgery within your overall treatment plan. So their unique value isn't just their skill with the scalpel, it's making sure their part integrates seamlessly with any medication or radiation therapies. It's all about creating a truly coordinated attack.
Makes sense. A combined effort. And then there are the oncology nurses. I've often heard them called the heart and soul of the care team.
That's very accurate. You'll likely interact with several nurses, all with specialized cancer care training.
Okay.
And two types really stand out in the sources: the nurse navigator and the infusion nurse.
All right, tell us about their day-to-day impact. What do they actually do?
Okay, so the nurse navigator. They might be one of the very first people you meet. Think of them as your personal guide.
Guide through the system.
Exactly. Through the often complex healthcare system. They help schedule appointments, make sure you understand where you need to be and when, and ensure your questions get to the right person. They really help prevent you from feeling lost or overwhelmed.
That sounds incredibly helpful. And the infusion nurse?
So the infusion nurses, they're the ones who actually administer your medications, like chemotherapy through an IV. They carefully monitor you for any reactions during the infusion.
Okay, that's critical.
Very. But they also provide just a wealth of practical day-to-day advice for managing side effects.
Like what?
Well, for instance, they might share proven tips for coping with nausea, maybe dietary suggestions, or offer simple strategies to help you conserve energy if you're dealing with fatigue.
So it's not just giving the medicine, it's like real actionable guidance for getting through it.
Exactly. Their role truly cannot be overstated. Oncology nurses are your day-to-day advocates. They're a crucial source of information, honestly, just comfort. And if we connect this back to that bigger picture, the nurses really bridge the gap between all the medical complexity and just the human experience of it all. They offer that constant reassurance and practical support.
Yeah.
They're often the first person you turn to with those immediate practical, what do I do about this kind of questions. They're absolutely indispensable members of your support system.
It's clear the medical specialists are crucial, handling the direct fight against the cancer cells.
Right.
But like we said at the beginning, cancer affects so much more than just your physical body.
Touches everything.
Yeah, your emotional well-being, your daily routines, even, practical things like finances. So let's broaden our view now. Let's talk about the allied health professionals who provide that essential sort of holistic layer of support.
Good idea. The wider circle.
First up, the social worker. I know they're often described as an invaluable resource for navigating both the practical and the emotional challenges.
Absolutely invaluable. And their role is wonderfully multifaceted.
How so?
Well, on one hand, they're trained counselors. They can help you and your family cope with the stress, the anxiety, the difficult conversations that inevitably come up.
So the emotional support piece?
Yes, that crucial emotional anchor. But on the other hand, they are incredibly practical problem solvers.
Okay, like what kind of problems?
Things like connecting you with vital community resources, maybe helping you understand financial assistance programs, arranging transportation to your appointments, even guiding you towards support groups with others going through similar experiences.
Wow, that's a lot.
It is. Their unique value is often alleviating burdens you might not even realize are weighing you down. They really act as a lifeline for all those non-medical needs.
A lifeline. That's a good way to put it. So they're not just waiting for you to ask. They can kind of proactively spot potential issues.
Often, yes. A good social worker anticipates those needs.
Okay. That brings us to another really critical support role, especially, again, for older adults, maybe managing multiple medications already. The pharmacist.
Absolutely critical, yes. The pharmacist is a vital safety expert on your team.
Safety expert. How?
Well, they will meticulously review all your medications, and I mean all of them.
Not just the cancer drugs.
No, everything, every prescription, every over-the-counter medication, any vitamins, supplements you take, everything. Their goal is to prevent any harmful drug interactions.
Which can be a real danger.
A huge danger, especially with complex treatments. And beyond that safety check, they can give you detailed information about your specific cancer drugs, explain exactly how to take them safely, and offer really good strategies for managing common side effects like nausea or fatigue.
Practical tips again.
Yes. And, this raises such an important question for anyone dealing with complex health stuff who is actually looking at the full picture of all your medications.
Right. Is anyone coordinating it all?
Often the pharmacist is that crucial last line of defense.
Correct.
They make sure everything works together safely. Their real value is that comprehensive oversight. It provides real peace of mind when you're juggling a complex drug regimen.
That oversight, that peace of mind sounds so important. Now, during treatment, we know good nutrition is essential.
Oh, absolutely.
It can really help you maintain strength, tolerate treatment better, recover faster, and this is where the registered dietitian comes in, right?
Exactly. A registered dietitian, especially one who specializes in oncology, will assess your specific nutritional needs. And those needs can change dramatically during cancer treatment.
Okay.
Then, they help you manage any treatment side effects that impact your eating. Things like loss of appetite, maybe changes in taste, difficulty swallowing.
Yeah, things that make eating hard.
Right. So, for example, they might suggest specific food textures or maybe flavor enhancers if you're getting that metallic taste some treatments cause. Or they might recommend nutrient-dense, easy-to-digest foods to help you maintain energy.
Personalized advice.
Very personalized.
Yeah.
They're experts at creating eating plans tailored just for you, making sure your body gets the fuel it needs to heal and withstand the treatment. Nutrition becomes a powerful ally.
An ally, I like that. Okay, and then helping maintain independence, quality of life, both during and after treatment. That's where physical therapists, PTs, and occupational therapists, OTs, come in.
Yes, another vital pair.
They both work towards a similar goal, right? Keeping you functional.
Yeah.
But how do their approaches differ?
That's a great question, because their roles complement each other beautifully, but they're distinct.
Okay.
So a physical therapist, the PT, will primarily help you with strength, balance, and mobility.
So movement.
Yeah, big picture movement. If fatigue is making it hard to walk or climb stairs, the PT designs exercises to combat that fatigue, improve your gait, keep you moving safely.
Got it. And the OT, occupational therapist.
The OT focuses on helping you perform your daily activities, what we technically call occupations.
Occupations like jobs.
Not just jobs, but everyday tasks. Things like dressing yourself, cooking a meal, bathing, managing your home.
Ah, the activities of daily living.
Exactly. If treatment has made those tasks difficult, an OT can teach you new strategies, maybe energy-saving techniques. Or they might recommend adaptive equipment, things like grab bars in the shower, or specialized kitchen tools to help you conserve energy and stay independent at home.
So PT is about moving, OT is about doing.
That's a good way to summarize it. Their shared value is maximizing your functional ability, helping you live your life as fully as possible, despite the challenges.
Okay. Now here's one we absolutely need to tackle directly, because it is such a common misconception that palliative care is the same thing as hospice or end-of-life care.
Yes. Thank you for bringing this up.
And that misconception often leads people to shy away from it, right? They miss out on support they could really use.
It absolutely does. And let me be very clear. This is emphatically not true.
Okay.
Understanding this distinction is honestly one of the most important takeaways from our deep dive today.
So what is palliative care there?
The palliative care team specializes exclusively in symptom management, and they can be involved at any stage of a serious illness, right from the time of diagnosis.
At any stage, not just the end.
Any stage. Their primary goal is simply to improve your quality of life. They provide an extra layer of support specifically focused on managing things like pain, nausea, fatigue, anxiety, any distressing symptoms you might experience. They work hand in hand alongside your oncology team to make sure you are as comfortable as possible throughout your entire treatment journey.
So it's about comfort during treatment.
Exactly. Palliative care is that extra layer of support for comfort and well-being. It is not a sign of giving up. It's about living better with the illness and its treatment.
That is such an important clarification, an extra layer of comfort right from day one, potentially.
Precisely.
Okay, so we've talked about this incredible array of medical specialists and allied health professionals, but here's where it gets really interesting, I think. Because the sources make it crystal clear that while all these experts bring the clinical knowledge, the technical skills, you and your loved ones bring the most important expertise of all.
Which is?
The knowledge of yourself, your life, your history, your values. You are the leaders of this team, undisputed.
That's absolutely right. You are the team captain.
So it's the medical team's job to give you information, recommendations.
Options, yeah.
But it's your right, and frankly, your responsibility, to be an active partner in your own care. Your voice truly matters most.
It does.
So how can someone actually be an effective captain, especially when facing something so overwhelming?
That's the key question. And there are a few concrete things you can actively do. First, and this is fundamental, be the expert on you.
Okay. What does that entail?
Well, nobody knows your body, your history, your daily life better than you do.
Right.
So it's vital to openly share everything. All your health conditions, not just the cancer, all the medications you take. And again, that includes over-the-counter stuff, vitamins, supplements, everything.
The whole list.
The whole list. Plus, your typical daily routines, who helps you at home, what your support system looks like. This holistic picture helps your team understand you beyond just the diagnosis.
That makes perfect sense. They need the full story to connect all the dots. Okay, what's next for the captain?
Second, and this is absolutely crucial, define your goals.
Goals for treatment.
Goals for your life that treatment needs to support. What is most important to you right now and in the coming months? Is it, say, being well enough to attend your grandchild's graduation in 6 months?
Okay, a specific event.
Or maybe it's maintaining the strength to work in your garden, or continue a hobby you love. Or perhaps prioritizing comfort and quality of life above absolutely everything else is your main focus right now.
So, figuring out what really matters.
Yes. Clearly articulating those personal goals helps your team tailor a treatment plan that truly aligns with what makes your life meaningful. It stops it from just being a standard protocol applied without context.
So making sure the medical path actually supports your life path.
Got it. What about asking questions? I imagine people can feel overwhelmed or even intimidated sometimes.
Absolutely, which leads right into the third point. Ask questions.
Don't hold back.
Never hold back. There is no such thing as a silly question when it comes to your health. Period.
Okay.
Write them down as you think of them. Keep a running list. Bring that list to your appointments.
And if you don't understand an answer, don't ever hesitate to ask for it to be explained again, maybe in a different way. Ask for an analogy, a drawing, whatever helps it click for you.
Right.
Understanding your diagnosis, your treatment options, the potential side effects, it's absolutely key to making informed decisions that you feel comfortable and confident about.
Okay. Be the expert on you. Define your goals. Ask questions. And finally, after all the info, all the discussion, who makes the ultimate call?
And that's the final point. You make the final decision. Your team will present you with options. They'll give you their best recommendations, explain the pros and cons of each path.
But
remember, the final choice is always, always yours. Guided by your values, your goals, your preferences, you are in control of the path forward.
you're the captain. And as the team captain, you also have essential allies. Your caregivers.
Absolutely essential.
This could be, the person or maybe people you lean on most for support. A spouse, partner, kids, siblings, friends, even neighbors sometimes. They play such a crucial role, don't they?
An absolutely vital one. Caregivers wear so many hats, all indispensable.
Like what?
Well, first, they act as a second set of ears during appointments. Those meetings can be overwhelming, a lot of information flying around.
For sure.
So the caregiver helps remember information, takes notes, maybe asks for clarification on points the patient might have missed or didn't quite grasp.
Okay, second set of ears. What else?
They're often your advocate. They can help voice your concerns, make sure your questions actually get answered, especially if you're not feeling your best that day or maybe too tired to speak up forcefully for yourself.
Having someone in your corner.
Exactly. Then there's the practical support. Huge. driving to appointments, picking up prescriptions, helping with meals, household chores, all the things that allow you, the patient, to focus your limited energy on healing.
Takes a load off.
A massive load. And perhaps most crucially, they offer emotional and moral support. Just being there, providing a shoulder to lean on, a listening ear, that encouragement you need to get through the tough days. Their presence makes an immeasurable difference.
It's so clear how vital caregivers are. But it also sounds incredibly demanding.
It is extremely demanding.
Which means their own well-being is critical too, right?
Yeah.
Because burnout, that's a very real risk for caregivers.
Oh, absolutely. Burnout is a huge risk. That's why we strongly encourage caregivers to seek support for themselves.
What kind of support?
It could be formal support groups for caregivers, maybe individual counseling, or even just reaching out proactively to other friends and family, asking for help with specific tasks, or just asking for a break.
It's okay for them to ask for help too.
It's it's essential. Remember, a healthy, rested, supported caregiver is a much more effective caregiver for you in the long run. Taking care of themselves isn't selfish. No, it's essential for their own sustainability and for their capacity to provide the ongoing support that you need.
That's a really important message for caregivers listening. Okay, so what does all of this mean for you, our listener? Maybe you're facing a cancer diagnosis yourself, or perhaps supporting someone who is.
Yeah, what's the bottom line?
It means that building your cancer care team is an active process. It's collaborative. It's not just something that happens to you.
You're a participant, not a passenger.
Exactly. By understanding these different roles, by actively engaging, asking questions, sharing your goals, this comprehensive team, led by you and your closest support, can create a plan that's personalized, supportive, and truly effective for you.
And that plan, it doesn't just treat the cancer cells, it also genuinely cares for you as a whole person.
Right.
Respecting your wisdom, your independence, your wishes, every single step of the way. It shifts the focus, really, from just fighting a disease to supporting your entire well-being. It's about being seen and cared for, not just treated.
That's beautifully put, being seen and cared for. So for you, our listener, here's maybe a final provocative thought to mull over. How might understanding all these diverse roles and understanding the real power of your own leadership as a patient, how might that not only empower you in a significant health crisis like a cancer diagnosis, but maybe fundamentally change the way you approach all your health and wellness decisions going forward?
Interesting.
Yeah. How can you become a better captain of your own overall health journey, proactively identifying and building your own robust support circle, maybe long before a crisis even emerges? That's something worth thinking about, isn't it? Taking the reins of your own well-being proactively.